In this video, we will discuss the true underlying factors behind the formation of gallstones. There is a prevailing misconception that consuming high amounts of fat is the primary culprit. However, this belief is absolutely wrong. What are the functions of the gallbladder? The gallbladder serves as a reservoir for bile, a distinctive yellow-green fluid synthesized within the liver. Bile is primarily used to digest the fats you eat. Where does the common medical belief that eating fat causes gallstones come from? When you already have gallstones and consume fat, these stones can be carried out from the gallbladder by the bile and potentially obstruct the path to the intestines. This often results in intense pain on the right side of the stomach and can lead to a biliary crisis. However, it is important to understand that fat itself is not the root cause of stone formation. Rather, it merely acts as a trigger for stone movement by provoking bile production, subsequently leading to acute pain. Hence, the usual recommendation is to follow a low-fat diet and take pain medication during a gallstone attack. If the attacks persist, the typical approach involves surgical removal of the gallbladder, which often resolves the problem, probably with the side effect of a slightly reduced ability to absorb fat and nutrients from what you eat. There's a reason we're born with gallbladders, after all. What is actually happening? The conventional recommendation of a low-fat diet doesn't lead to the resolution of gallstones. Instead, it often worsens over time until surgery is required, and it's not just a coincidence. How do gallstones develop? To answer this question, we must first clarify the composition of these stones. Although there may be some variations, the majority of gallstones contain these three elements in descending order: cholesterol, bilirubin, and calcium carbonate. This composition is completely different from the composition of the bile, debunking the notion that stones are formed when the bile stagnates in the gallbladder. Once cholesterol enters the bile, it begins to settle and form small grains of sand, which can eventually develop into gallstones. This happens when there is insufficient production of bile within the liver. Bile plays a vital role in preventing the consolidation of cholesterol into solid formations, as well as serving to remove excess cholesterol from the gallbladder. However, when bile is produced in insufficient amounts, its ability to counteract cholesterol diminishes, thereby initiating the process of stone formation. What are the causes of insufficient bile? 1. High insulin levels. Insulin is secreted in the pancreas upon intake of carbohydrates, as well as excessive consumption of proteins and their combination with carbs. All carbs lead to extremely high levels of insulin secretion. Complex carbohydrates such as pasta, rice, potato, and simple carbs, anything that contains sugars and tastes sweet. Alcohol can also be counted as an ultra-fast carbohydrate. 2. High estrogen levels. High estrogen levels are most commonly seen with hormone therapy, birth control pills, and pregnancy. All of these conditions can increase estrogen levels, which is an indirect cause of reducing bile production in the liver. 3. High cortisol levels. Besides the direct intake of cortisol from cortisol-containing drugs, conditions of severe stress can reduce bile production, since then cortisol secretion increases. 4. Low-fat diet. All types of diet low in saturated fat are a major cause of gallstone formation. Eating fats of animal origin, such as butter, cream, lard, lead to the secretion of bile, which serves to break down these fats. If you eat a high-fat, low-carbohydrate diet, you will have a constant flow of bile, which will eliminate the possibility of stone formation. In conclusion, the primary factor behind the development of gallstones is the insufficient production of bile. To prevent this, simply adhering to the principles of a high-fat, low-carb keto diet is enough. One last request from our team. Please give us your feedback about this video in the comments section. If you enjoyed it or have any suggestions for us, we would greatly appreciate your input. Thank you.